So Alison, well, you're now at the point where you have good asthma control. This is a good time to work through a written action plan with you. We've prepared this written action plan with your doctor, and I'm just going to take some time to go through it with you. The idea of having a written action plan is to go through some instructions with you about how to treat episodes of asthma. So we'll work through this colour-coded plan where we look at 3 different sections. The first is a green section, and that identifies when you're well and your maintenance therapy. So during this time you'll continue to take your current maintenance therapy for your asthma with the addition of some rescue therapy 10 minutes before netball, for example. The next part of the plan goes through some symptoms you should recognise when your asthma is getting worse and provide some instructions for you to implement and change your treatment at this time. What kind of symptoms do you recognise?
I find I start to wake in the middle of the night more, and I have to use my reliever more often.
Okay. And do you do any regular peak flow monitoring?
No, I don't.
No? Okay. So what we might do then is we've worked this plan out so that it's tailored to your symptoms and the worsening symptoms that you experience when you have asthma. So as you've said, you wake up at night time with more asthma symptoms and you use extra rescue medication, and it may not be as effective as what it normally is. Other warning signs include things like symptoms when you wake up in the morning, as well as the onset of a cold, as most people will get worse when they experience a cold. If those things are happening, you need to know what to do and how to take action. So this plan highlights to you what you should do at this point. We'd like you to increase your treatment as instructed in the plan and have additional rescue medication as needed. Now, you need to know for how long you should continue this treatment. You may start to feel better within 2 to 3 days. Despite that, you should continue this treatment for a period of 2 weeks. If you're not responding to this increased treatment, you should see your doctor within a couple of days. Usually implementing this component of the plan will improve your asthma symptoms. However, at times you might have a severe episode of asthma and you need to know what to do at that point. What kind of things do you recognise when you're having severe episodes of asthma?
I find I start to wake in the middle of the night more, and I have to use my reliever more often.
So they're some of the symptoms that happen for a severe attack of asthma. Other things might be that you're only able to speak in short sentences or words. As you said, you may be a little bit frightened and panicky. Or if you're needing your rescue medication more than 4th hourly and you're not gaining an effect. At that point, what you need to do is take some rescue medication, follow the plan according to what's written here, and seek medical attention immediately by calling an ambulance or your GP. You should then continue using your rescue medication every 4 minutes until help arrives. So Alison, now that we've gone through that plan, how do you feel about it?
I think it'd be very easy for me to implement it. The instructions seem very clear, and I'm pretty happy with how it's set out.
And are you happy with the instructions that we've written here on this plan? Would you be happy to implement that if these symptoms do occur?
Yes, I do. I'm definitely confident to give it a go.
Okay, that's great.